Welcome to another episode of Do You Even Live Here? My name is Preston Blakely. I'm the mayor of Fletcher, North Carolina, and I'm here with my co-host, Dalton George, the mayor of Boone, North Carolina. And folks, we have an exciting episode here today. We have one of my favorite people, Dr. Laurie Stradley. Dr. Laurie Stradley is the director of Impact Health, spent nearly 20 years working at the intersection of healthcare, public health, and community wellness, with leadership experience ranging from Mission Health to national nonprofit organizations focused on improving health outcomes for children and families. She's a longtime West North Carolina resident, which obviously Dalton and I love as West North Carolina folk through and through. And she's someone who dedicated much of her career to tackling the factors that shape health beyond the doctor's office. Laurie, we're excited to have you. And for those who may not be familiar with your work at Impact Health, tell us a little bit about yourself, how you found your way into this work, and do you even live here, Laurie?
I do live here. I can't claim born and raised, but I have lived here longer than I've lived anywhere else. I can claim these mountains, though. I grew up in the Adirondacks on the other end in northern New York, and I've been working my way here ever since. So I do live here, and I'm proud of it. And I love that a big part of my job is shining a light on how incredible the people and the work of Western North Carolina are. It's a privilege to say, yeah, I live here.
And we're glad you're here. Just before we hit the record button, we were talking about all the extraordinary happenings and people that are here in West North Carolina. And again, Laurie, you're one of those people. So tell us a little bit about Impact Health and a little bit about the work that you do there.
Yeah, Impact Health is a nonprofit based in Asheville, but serving the 19 westernmost counties of North Carolina. And we're just a little south of you, Dalton. We don't get to work directly with you, but State and Boone are near and dear to everything we do as well. So Impact Health came together right around COVID. And the way that we do our work, we're what's called a social care hub. And our job is to connect with folks all over the region who are doing great work. And in many cases, they've been doing it for generations. They're helping to feed, house, and transport their neighbors, keep them safe in family violence spaces, and just really take care of each other. And our job is to support and coordinate with those agencies all over the region and try to draw more funds into the community. And the last step is bridge it with our clinical spaces so that if someone comes in, maybe for their annual checkup and they get a diagnosis of diabetes, we know there are medications, there's education, all you need to know about it. But at the base of it is, do you have good food to eat? And so our job is to help that clinical space connect with someone who's already in the community to get good food in that household. And so we've worked with a program called Healthy Opportunities, which serves our Medicaid members across the region. We're now pivoting to expand that to something called Rural Health Transformation. And it's an incredible job. I get to work with brilliant people in Impact Health and then just incredible, compassionate, talented folks in every county of the region. It feels like every thread of my professional and personal life is coming together in one space. So I hope I get to do this work for a long time, until I put myself out of a job. That's always the goal. If nobody was hungry and everybody had what they need, I would be happy to retire early if I could pull that off.
Yeah, I make that joke all the time. I'm like, I wish the world was so just and there were so few problems that I could lay on my couch all day and read a book or play Super Smash Bros. Or something like that. And unfortunately, I'm not the type of person to sit aside while I feel like there's good work to be done, but I'd love for a world where I could comfortably relax all the time. I love the fact that you've worked your way down the Appalachian Mountains down to the southern area. And as you said, you're in the western part of the state, which does not include me. I'm the northwestern part of the state. And y'all as Westerners, I always get picked on. When I was organizing for Down Home and I was part of the Western organizing team, I had somebody that was out in Murphy and they're like, do you have anything really in the West? Because Boone is not in the West. And we fought a little bit over that.
You're borderline, Dalton. You're borderline, dude.
Look, y'all, anywhere the ground is uneven, I think is Western in spirit, is my attitude. I'm less interested in the map. But I will say, Laurie, I'm curious your perspective. You're in probably the most rural part of our state doing something like healthcare that is often impacted by this kind of rural-urban divide, the lack of investment. We're seeing closures in hospitals, so many different things, and a state budget that is so intimately tied to that. But what are your experiences in navigating a rural, less centralized area and addressing one of the core problems for a region like that, which is healthcare?
Yeah, we've known for a long time that there's just something fundamentally different about accessing healthcare in rural spaces. I think we focused a lot on access and in many cases socioeconomics. So poverty is often associated with being in rural spaces, but no matter what you have and what your personal status is, it is harder to get healthcare in a rural space. And it becomes infinitely harder when you don't have your basic needs being met, like transportation. When folks think about health and health outcomes and in rural spaces, is, you've got to talk about transportation. The US as a whole isn't great with public transit. We're just super car focused, and cars are incredibly expensive to maintain. Even if you can get a car you can afford, all the pieces around it, from insurance and registration and taxes and all, it's hard to keep your car on the road. And so when we think about rural health, we've got to take that into account and then think about all the solutions that might present if you can't get a safe and functioning car. And that was one of the cornerstones of Healthy Opportunities. We were able to help folks with gas money, with car repairs. There's this incredible organization in Western North Carolina that I got to shout out. They're called Working Wheels. And they recognize that health and economic mobility are rooted in transportation in Western North Carolina. And they were an incredible partner through the early days of Healthy Opportunities. And that's what's really interesting about Healthy Opportunities. We actually have Medicaid dollars, so true healthcare dollars, that for the first time, we're investing in all of these different social drivers of health or non-medical drivers of health, everything that happens before you walk through your doc's front door. And so we were trying to look at how can we make it so folks are healthier, have better access to the care they need, and what they need to thrive before they get a diagnosis. And so those things are so important in our rural spaces. And the good news is, in Western North Carolina, we have always leaned on each other and supported our neighbors. There's even an organization that we worked with called Neighbors Feeding Neighbors, and connecting them and plugging them into the system and making it so every individual doesn't have to navigate the whole system on their own. Because even though we're good at leaning on our neighbors, we're also not great at asking for help. We think we can do it. We always assume someone has it worse than us. If I got one can of beans in my pantry, I'm not food insecure. And so creating a belief that these benefits are yours and we want you to be well, we want you to take these pieces into consideration. When we do all that really well, the access to clinical spaces becomes slightly less emergency and a little more go with the flow. It's been so important to think about clinical health in a different way. And Western North Carolina has just been shining. We are a national beacon right now. I get asked to speak at national conferences and in webinars because the rest of the country wants to know how we did this as well as we have.
So if you can do it well there, you could do it well anywhere. And one thing I'll add too, it's even bigger than feeling like you don't need the help because somebody else is doing worse. And so you don't want to ask, but also the shame and stigma that's associated with needing a hand, and being able to provide services and humanize people and let them know, hey, just because you need a little help, there's no shame in that. And we as neighbors, we as a community, our governments ideally should be designed to take care of people that have stumbled a little bit, right? That's the world I want to live in. I want to live in a world where, because I always say this quote, I don't even know where I picked it up. I think it was my grandpa, but we all do better when we all do better, right? Like, it's really that simple. Every person, I think, would be better off to understand that.
Yeah. When we think about some of the pride I think that we have as folk in Western North Carolina and having a really hard time going out there asking for help, I really think back to our guest, and I think Deborah came on the show and she said it's not a handout, it's a hand up. And I think about my own experience, and I think about Hurricane Helene, where that was truly the mecca of what you're describing, Laurie, of folk in West North Carolina not always wanting to ask for help, but showing up for each other, even though you maybe needed more help than your neighbor. And I even think about my own experience. I remember during Hurricane Helene, I had a couple slices of bread left, and I'm like working the distribution center at Town Hall, and I'm feeling guilty. And in my head, I'm like, I should probably take some food. But at the same time, I'm like, there's this long line of cars where these folk need food, and I'm hand the food out to them. But in my own reality, I probably need to take food home too. And long story short, I didn't. But in hindsight, I probably should have. I wouldn't have to be cutting my PB&J in half. But to your point, I think a lot of these rural areas that you all serve, and I think about some of the consequences of cutting Medicaid. I think about like Macon County. I'm not sure if you serve the folk out in Macon County.
We do.
I think about Macon County, and I worry about the hospital system out there and whether they're viable to stay there long term, because as they see these cuts to Medicaid, a lot of those folk are already having to drive really long distances to get some specialized care. But if those hospitals aren't able to stay open, they won't even have that there. So they're not only driving for specialized care, but they're just driving for care in general. And so I worry a lot about what's happening at the federal level and at the state level in terms of Medicaid dollars as it relates to HOP, but also as it relates to just healthcare in general, right? Just our hospitals, our doctor's offices, everything.
Yeah, absolutely. There's so many pieces. And one of the complicating factors about rural health transformation is recognizing that we need to keep people well. And rural hospitals are a volume game. If they're not seeing enough people, they can't keep the overhead and they can't keep the doors open. So that's why we've seen a lot of labor and delivery close. So if you're in Macon County, you already can't have a baby in your county. You got to travel. We're trying to keep people well, but you got to have a baby. We don't want to prevent that. We want folks to have families safely where they live and not have to leave. And we know a lot of young people are leaving our region because they want to have close access to things like healthcare. And they worry about having a baby in their small towns because what if they need some help? So one of the ways that rural health transformation is going to focus on this, we may not be able to keep all of the operations of a hospital system open, but when there is a critical need, so let's say you're out in Macon County and you go into labor and it's a difficult labor and delivery, we're going to make sure that the EMS folks who are transporting you have the training and skills that they need to care for a woman in labor for the, say, 2-hour drive to Mission to get to the NICU so that when she gives birth, they're going to have the support they need. And so it's really about strengthening connections and truly having a healthcare system, not just a bunch of pockets of care that don't talk to each other and can't move between each other, to make sure that those critical access points stay available. Maybe it means they need more technology to be able to get a specialist on the phone because we can't afford to have that specialist live there. If your hospital is delivering less than a baby a day, you can't have a 24/7 staff ready. And so that means your labor and delivery is going to close. But what if we had some really high-level cardiothoracic specialist that maybe lives and works in the Triangle, but consults every day with folks who are coming in and he's reading EKGs and all that good stuff? Maybe we can keep that hospital open and functioning for the most critical needs and then have the threads we need in place to transport someone if they're going to be there. So that if you are having a crisis, you still get to go to the emergency room and have experts tell you what you need and where you need to go. And then you have medical expertise transporting you. Because nobody wants to be driving in the car for 2.5 hours with chest pain. That is terrifying and it's not going to be good. And in some cases that will lead to death.
Absolutely. That speaks to, I know here in Watauga County, we are lucky enough to have a pretty well-funded hospital here in Boone. Just a decade ago, I've talked to young mothers that have, when they needed a cesarean, they had to go to Winston-Salem, right? They went to that hospital and thankfully were able to be transported by ambulance, but that costs a lot. And it just goes to show that while these hospitals and everything are vital in these rural places, the more specialized care, you still need the transportation infrastructure in place because it's going to take a while to get there. As we talk about transport and so many other things, the need in transport in health, right? Whether you're just communicating with these folks, trying to get them there or getting them to centralized specialized care. I have it on good authority that you drove around in a Be Active van. And so I want to hear a little bit about that because that involves a lot of transport in and of itself.
Yeah. My first nonprofit job when I moved to North Carolina. So I grew up in the Adirondacks. I went to college in Virginia and then I moved to Chapel Hill to go to graduate school. So I do have to admit out loud, I am a Tar Heel.
You're breaking my heart. We have beefed on this podcast.
Yeah, there's some history there, but you're on the right side of things, Laurie. That's okay.
Some people
on this podcast, some people on this podcast are on the wrong side of things, but we're proud of them still.
I mean, you know the saying, right? If God isn't a Tar Heel, then why is the sky Carolina blue?
My grandma is the diehard. I was like, those are my nursery rhymes. And when I told her I was going to Duke, it actually was equivalent to telling her like I was going to prison. She was heartbroken. She's all right, you. That's devastating. But yeah, I got to give you a little bit of grief for being a Tar Heel, Laurie, even though I love many Tar Heels out there.
We have a little bit of rivalry in the house. My husband is also a Tar Heel, but he works in college sports broadcasting. And after the hurricane, we actually lived in Durham for a little over a month. My daughter was just starting her freshman year of high school when the hurricane hit here, and it really weighed on her. It felt like COVID all over again. She was in 5th grade when she got sent home from school.
Wow.
I think she didn't get to spend much of 5th grade in school. And if you remember elementary school, 5th grade is when North Carolina does our first student government. She's excited about it, didn't get to do much of that. So when the storm hit her freshman year, she wanted to be in school. She thought she was going to lose her whole freshman year. So we had to move. My work is about staying connected, moving funds, connecting resources. So I needed to go somewhere where I could have a phone. And so we ended up in Durham, and my husband started broadcasting for the Duke women's soccer team. And when they found out that we were hurricane refugees living in Durham, they sent home a bunch of Duke gear. And so I owned some things in the wrong blue, but as much as the rivalry is a good time, there's good folks all over. And to be fair, a good number of the Duke leadership went to Carolina.
It's funny because there is a specific academic program where you go to both. The schools actually work so well together. And that's the great irony of the sports hate, because there's so many students that go to both campuses. And I'm happy to be going as a grad student because I'm actually less invested in the sports for that reason. But
That's true. But
yeah,
that's how I ended up in Chapel Hill. I was going to grad school there. And when I finished up my degree, and I can say at that point, I didn't even know what public health was. I had degrees in exercise physiology because I knew the human body was incredible and I wanted to be somewhere health adjacent. I didn't know what it was going to be. And I spent my first 6 months after grad school working as a consultant for the Army doing physiology research. And it was good work, important work, but it wasn't filling my heart. So I took this job in Chapel Hill driving the Be Active van. It was funded by Blue Cross Foundation. And that was my whole goal, was to drive around and try to make people believe that moving your body matters any way you do it. You don't have to have weights. You don't have to be in a gym. You don't have to go for a run around a track. Any way you can find joy and move your body is a good thing for your health. And I got to go to pretty much every festival you have ever heard of. I've been to the Blueberry Festival in Pender County, the Seafood Festival in Morehead City. We got the Pickle Festival in Mount Olive. And then Dalton, I have been to the Woolly Worm Festival. It is a thing to behold. And I will admit, I didn't know that my entire winter could be predicted by the woolly worms that were coming across my path. So I got to see truly every corner of the state. And so my husband, who grew up here in Asheville, and apparently there is a Stradley Mountain somewhere. I haven't been on it, but there's one out here. So his family's been here for a minute. So getting to know all of this, I got to see how diverse North Carolina is. So we've got the mountains, we've got the triad, we've got the ocean, we've got rivers and lakes and all kinds of different pieces. We've got all the different education systems and programs. We have 115 school districts in this state, and each of them operates just a little bit differently. And I got to see a lot of our school systems that way. And then really something that just has stayed with me for 20 years at this point, 22 years, is the economic differences and the access to all kinds of things across our state. Just here in Western North Carolina, you can see a multi-million-dollar second home cut into the side of the mountain that is just stunning and makes you just want to go in there and sit. And it's looking over what you would assume is an old shed or shack that isn't working anymore, but somebody lives there. It doesn't have running water. And these things are side by side in different ways all over our country. You see the same thing in the coast. We have such a beautiful and desirable state that you see a lot of haves and have not happening here. And I think I've only seen that gap widen in the 25 years I've been working in North Carolina. And I see what health means. I saw a woman speaking about this at a funding event one time. She grew up in Rutherford County. And she went on to become the head of a couple of different foundations that were making investment in the community. And she said, whenever I go home, people say, oh, you look good. You look good. And she said it took her a few trips home to realize what they were saying is, you look healthy. You look well. And to see that once you have access to the food and to the home, and honestly, to the lack of stress, we don't talk enough about the stress of living in poverty. If you talk to somebody who is balancing a tight income and all of their household numbers, you will meet a math wizard. I'm telling you, to be able to figure out what day I have to pay what bill, which bill I can stretch, which bill has the worst late fees, which bill is going to put my housing at risk versus anything else. The amount of mental load on our folks is just off the charts. And so to see those differences has just shaped the way that I do this work and that I have the privilege of connecting people to resources to make sure that we all have the chance to meet that bare minimum so that we can thrive and be well and come home and have someone say, you look good. You look good.
Well, that's the piece of poverty I think so many folks miss, right? The mental load of just trying to make it, of stretching, of sacrifice. All of these people point out this person has struggled for a long amount of time. So it's some sort of failure or individual failure. And people don't realize it's a full-time job to be able to put food on your table, to look strong to your children, right? To not let them know how you're dodging foreclosure or what credit card that you're maxing out. And the mental energy and the toll that takes puts you on survivor mode. And so the ability
Yeah.
to have some sort of on ramp to stability, which is what you're providing in the healthcare space, is so incredibly vital. And that's the part of poverty people miss out on. Every moment when you're struggling in that way is consumed with what can I do to just wake up tomorrow and do it again.
I think when you're living in that space we've just been talking about, there is no way out. There is no way to break that cycle. You're one flat tire away from homelessness, and people have a hard time making that connection. So that flat tire costs you the direct cost of the tire plus a day's work. And now you're not going to make rent this month. And you already missed rent 3 months ago, so you were paying more. So just this ripple effect. And so when we talk about a hand up, it's about stability. And one of my favorite stories from HOP that I tell everybody, one of the services was a food box delivery that comes every week. And when holidays are coming and the nonprofit might be closed, you get 2 weeks of groceries that week. We're not going to leave you hanging. And this mom shared with us that part of the service is knowing what the family likes and eats and what allergies they have and all of that. We're not trying to send home a bunch of organic eggplant for a household that's never seen an eggplant before. So, we know the kids love apples. We know the kids love berries. We know that fresh cucumbers in the summer, they smell so good and they're so crisp. So the nonprofits that we work with are not just dropping a box off. They know the family. They know what the family likes to eat. They know what their family cultural history is. So maybe there's going to be cornmeal in one of the boxes and there's going to be grits in another, because that's what that family enjoys. And so this mom told us, she said, I know my food box is coming on Friday. I know my family's going to eat. So I feel safe paying my full rent on Wednesday. That's disrupting all these different areas. It takes the mental load off. I know I'm going to pay my rent and I know I'm going to be good for the month. It takes the income. So, she pays her rent on time, so she's not going to hit that 5% late fee. So with the simple food box delivery on a Friday, we've stabilized housing. We've made sure this family has good food to eat, and we've reduced the overall stress of the household. And then they can do things. Our families can go back to school. We've had folks finish nursing school. That's one of the best economic mobility options in our region. The stories like this are endless, and it plays out in the data. We just had the research published last week that showed us that the folks who have access to this truly cost less. And where that money is being spent is with our local farms, with our local grocery stores, with our handymen and women, the folks who are fixing roofs and repairing plumbing. That money stays in our community. And so it's not just an investment in the folks who need the direct service, but it's an investment in the skills and talents and commitment of the folks who already live here too. And so back to Deborah's story, she was already taking care of the community. The reason she found out and got looped into Healthy Opportunities is because she was already helping other people get access to that. And so when her turn came around, she knew there was no shame in it because she's been helping people stay connected to it. And she went right back to work and never stopped.
Folks, if you haven't listened to the Deborah episode, go back and listen. She's an incredible and an inspiring woman. But to your point, Laurie, she's one of those people that worked hard her entire life and did all the things that society tells us to do, yet she still needed, again, that hand up to get that support for her and her family. And I think as we think about Healthy Opportunities Pilot, I think back to some of my time in grad school where I did some work with a housing organization in Asheville. And that was the first time I heard about trying to get people in full-time housing, get them out of homelessness, right? And they talked about some of the health outcomes that came with this. And when I think about Healthy Opportunities, it encapsulates reinvesting into our entire community. The study that I think you referenced, and I'm curious if you dug any more into it, I think it said that it saved us on average $164 a month for North Carolina Medicaid beneficiaries. That's a big number when we talk about how many people are receiving Medicaid. I think there are over 30,000 people just enrolled in the Healthy Opportunities Pilot by itself. That's a really big deal.
Yeah. One of the reasons that our healthcare system doesn't function for everybody is because the costs are exploding. So the cost of providing healthcare is incredibly expensive as our population is sicker and older. And we just keep throwing money into this sort of black hole of healthcare without any real ideas about how to slow that spend down. So this shows us that it is possible, and it's possible quickly. This is only 2 years of data that we're looking at, and that's how quickly we can bring down the cost of healthcare by investing in what mostly drives healthcare. So when you talk about social drivers like housing and food and transportation, the things that happen before you get into the doctor's office, that drives about 80% of our health outcomes. And so if we can get those things driving in the right direction, then we're going to bring down the cost of care to the whole system. And that's good for all of us. When we're all good, we're all good. That's the whole idea here. And so you think about folks who are, say, living in a house that has mold in it. You got a kid who is now developing asthma. And when you go to the emergency room with asthma, any kind of respiratory distress, that costs about $1,500 every time you just walk in the door to get a nebulizer and get your breathing back on track. And if we can pull out all those environmental triggers, so maybe there's a moldy carpet because it got wet, and we can put in some vacuums that have a HEPA filter in it. So when you vacuum, it doesn't kick more dust up in the air. So now that kid comes home from school and there are no more environmental triggers in the household, and they're breathing easy and they're not going to the emergency room. So ripping up that carpet and putting in that equipment probably costs $2,000, $2,500. And it was probably a local carpenter that pulled up that carpet and put down some hardwood. So within 2 months, we have covered the cost of that treatment. And now we're taking some of the burden off the healthcare system. And I don't know about you, but if I or a loved one are in a time-sensitive emergency room visit, like a stroke, I don't want a preventable illness in front of me in line, because we could have taken care of that. We could have made sure that person was not in respiratory distress to begin with. And so the changes make a positive impact on all these levels. If you get back to that issue I mentioned about rural healthcare or hospitals being a volume game in order to cover the cost, we have got to admit that there is not a for-profit business model that operates in rural spaces. We need to collectively invest in our community hospital systems above and beyond what someone pays to physically be there. Our municipalities, our state government, and our federal government has a vested interest in sustaining our healthcare systems, and we have to ask them to pay attention and to make that investment.
And local leaders need to advocate as well. I mean, the thing that kills me as somebody in local government is we often separate ourselves from healthcare as an issue because it isn't something that we can enact through ordinance, right? Or we run and say, we're going to fix healthcare. And there's a great medium where we can be good ambassadors on it. And I'll shout out Preston and Fletcher. They passed a resolution asking for action and oversight related to a hospital in Henderson County. But also one of the things that we help fund here in Boone is we help fund a program through the local Women in Agricultural organization that essentially stretches SNAP and food stamp benefits to allow them to use it for local food at the farmer's market, right? And it's like, that's the food is medicine model. That's all these things. And local governments can act on that. If you have a healthy community, you're going to be better off in so many different ways. Your economy is going to be better. You're helping out your carpenters, your local farmers, all of these different things early in that process. And one of the things I want to talk about, we talked about the state, the Fed, all of these different roles. We've talked a little bit about HOP, Deborah's connection, right? These kind of bigger cuts that are coming and this long-term sustainability of HOP being funded through the state. There's all kinds of things going on in the funding world and a lot of questions. So I'm sure you're the person for it.
That's a big question. I think that's going to be a couple people's dissertations over the next few years.
Yes.
With all the changes. This is the most volatile, might be too strong a word, but up and down of healthcare that I've experienced in my career, where there are so many changes and a lot of confusion. There's just so much happening all at once. And with Healthy Opportunities, because we were allowed to use Medicaid funds, it's something called the 1115 waiver. And it's been a part of the Social Security Act and Medicaid from day one, because they knew that we need a sandbox to play around in and figure out how we could do this better so that we can make recommendations and improve Medicaid over time. So we're operating what's called a demonstration program for Healthy Opportunities. It's not standard. And we work with Centers for Medicare and Medicaid services that under Health and Human Services to get approval to do this. And it's got to have some indication that it's going to work, a little bit evidence-based, and we have to be cost neutral. And so that's why we got to launch HOP. In order to do that, there has to be some state seed money combined with the federal resources to do this. And those services that we can pay for, the same way you would pay for a prescription or for a trip to see a specialist, we could pay for food or housing navigation or any number of services. That operates just the same as all the rest of Medicaid, where in North Carolina, about 2/3 of that money is federal and about 1/3 of it is state money. So we always need the state to stay invested in Healthy Opportunities to be able to offer it. And because the state did not pass a budget last year, we've actually been on hold since the new fiscal year started. We're one of many programs that live in the non-recurring budget because we're a pilot program and we need the funds to keep going. So we have to prove ourselves, which we have done. We have great research that shows that this is doing everything we need it to do and then some. So we have been in conversations with our legislators trying to make sure that they understand every aspect of this program, recognizing that there are only so many tax dollars and there is quite a lot of need to really help our legislators understand the direct impact of healthcare investment and the cost of Medicaid for this state. This is the first time we've had an investment in a Medicaid transition that is truly bending the cost curve. That's never happened before. And at a time when we've transitioned into this Medicaid managed care model, that's especially important because if we're going to keep that system in place, it has to start to cost less money. We have to do this work in order to meet the needs of the day. So we have some great champions. I'm happy to say that Healthy Opportunities has bipartisan support. There's no red or blue to this. There's an understanding that folks need access to their basic needs before they can thrive and before they can become a part of the stable workforce and cost less and all of those good things. So there's a lot of support there. But again, it's about competing for the taxpayer dollar to make sure that everyone stretches as far as possible. So we've really done a lot to make the case. There's, I think, a lot of optimism. So we are chewing our nails down to the beds, trying to see what's going to come out of this budget in the next week or two, because we think the case is very clear for Healthy Opportunities to keep going. And we're ready. We've kept the system intact. We have great partnership and support from the Dogwood Health Trust that recognizes how important this is as well. So we've kept our network intact and we're ready to go tomorrow if they will give us the allocation. So it is something that is a proving ground. In fact, we had, I think just 2 weeks ago, the head of Medicaid for the US, his name is Dan Brillman, and he came down to say, and he'll probably have to beg me not to quote this sort of thing, but he said, we wish everybody would just do it like North Carolina does. So when the head of Medicaid for the country says, you guys are doing it right, we need our legislature to listen, because Centers for Medicare and Medicaid Services see the need for us to invest in social care, navigation, and services. It is the best opportunity that we have to reduce our overall healthcare spend.
That is awesome to hear, and something for North Carolinians to be proud of. One of the things I want to pull out that you said, Laurie, is one, this is bipartisan, which is rare in this day and age that anything is bipartisan. So it's great that legislators are working on solutions here, and also recognizing, I think sometimes even for me, and I'm very entrenched in politics, like we've been without a budget for nearly 3 years, and the government still operates, at least from the outside perspective. It's not like the Fed government with a shutdown. It's not like we talk about it all the time. And I think the perception of some folks that aren't super involved is maybe it's not that big of a deal, but programs like this, like you said, aren't recurring, that are providing life-saving care, preventative care, all of these different things are the most impacted. And I don't think we talk about that enough, that the broader dynamic is, oh, it's funny, they haven't passed a state budget, they're not doing their jobs. And also there is a real world impact to so many different things across it. And just because North Carolina still functions by and large doesn't mean it's more in spirit than actual effect. And it's important for folks to know that.
Man, you took the words out of my mouth. I was thinking about that piece too. We talk about all the things, these various impacts of the budget. And again, this is not a recurring expense, right? And hopefully it is going forward. And so I'm keeping my fingers crossed for you all. I am really encouraged to hear that it was such a bipartisan effort. Have there been any conversations with legislators that have been optimistic that this was going to get done and it's going to get funded this year? What's your prognosis right now?
I would say that most of the folks involved in the budget process are pretty tight-lipped, but it's because they have to build the consensus within their walls before they can really start to build it outside. But I got to give a shout out to one of my favorite people, Senator Jim Bergen. He's down in Harnett County, southeast of Raleigh, I think, and he just really gets it. He's head of healthcare appropriations on the Senate side. And he has been a champion and a learner. That's what I think is really important too, is that when the budget didn't pass, it gave us some time to really sit down with folks and tell them what's going on. And he's just a curious and caring person. He really understands what our communities are needing. I'm really proud of the way that a lot of our representatives in North Carolina are staying out of that sort of political vitriol that we see in so many places. They're really folks who are from here and serving on purpose. This is public service. It's not about power and privilege and money for most of our legislators. It's about taking care of the hometown they grew up in. Most of our legislators are born and raised in the counties that they serve. Another person who's been really deeply committed to this work is Senator Ralph Heiss, who is born and raised in Spruce Pine, raising his twin boys there. really cares about access to health and food, was very much involved in, we're all survivors of the hurricane as well as contributing to the rebuilding. So he's another one that has stayed really close to this conversation and really believes in it, not just because it's the right thing to do, but because it's the right way to spend North Carolina's healthcare dollars. Julie Mayfield has been another huge proponent of this work, recognizing again that we can't wait until people are sick and in the emergency room to try to intervene. So she's been a great colleague there and really has her eye on all of healthcare in Western North Carolina. And then from another perspective is Eric Ager. His family has been working in farming here in Western North Carolina for generations, and his understanding of how this works has been just incredible to see how effectively our farms, our farm workers, and our farm leadership are now part of the healthcare system. And that's a pretty exciting thing to be able to say. With Healthy Opportunities, we worked with over 400 farms across the region that were selling into the program: eggs, poultry, fresh fruit and vegetable. So when I say that it's bipartisan, each of those 4 people brings very unique perspective to why this matters. And that's, I think, what makes it easy to get your arms around, is that it doesn't matter which angle you hold this thing up. It works. It works economically. It works for healthcare. It works for compassion, kindness, and care. It works financially. I probably already said that once, but I have to keep hammering that because it does. And it's really been nice. That's part of this advocacy work, is thank you for starting this at all. Most of these legislators had to take a risk and vote for this money in that budget 3 years ago. So thank you is always my first piece. Thank you for letting us try this. We have to keep going. There is no other better way.
Absolutely. And I tell you what, I've been deeply appreciative of all the names that you just listed off. Again, these are Democrats and Republicans that are for this issue coming together to really support our Western North Carolina and our state as a whole, right? There's other states copying the things that we're doing in North Carolina because, again, we're doing it right, which is a big plus and a big pat on the back to our great and wonderful state. And as we wrap up, a couple of questions. One, is there anything that you wanted to say that you haven't said about Healthy Opportunities Pilot or rural health transformation? And what should folk be doing to advocate for Western North Carolina going forward?
I don't think there's anything I haven't said, except I want to thank both of you as local leaders for being engaged in this, because if we just sit and make decisions in Raleigh, it's not going to show up here. And so for you two to keep this open communication and keep bringing up topics that matter here, I just appreciate you both so much. So thanks for having me, but thank you more for doing this at all. And with respect to Healthy Opportunities and rural health, these are 2 of the biggest investments in Western North Carolina's healthcare in decades. And so we want to make sure that we know what is happening. So reach out, Impact Health. Our website is just impacthealth.org. And you'll see links and spaces where you can connect with us, because the only way to do this right is to stay close to community. And that's where the solutions live. So we need to hear from you in order to do this. Our job at Impact Health is to navigate all the red tape and all the compliance work and stay on top of the legal aspects. But the actual change making and the programs and processes, those already live here. We're just trying to invest more deeply in it. So please get in touch if you have a good idea or a good relationship. And we need formal leaders. Sure, we need people who run organizations and hospitals, but we need the folks who are making changes without a title. We need to hear from y'all about what's working in your own backyard. And then Preston and Dalton, I'm going to ask you to help me stay connected with our local governments. And what's the best way for me to get in touch with you and ask how you see this working and where we can braid together funding and policy and commitments to make sure that nobody is left out of this important investment while really tough things are on the horizon right now. We've got to be ready for whatever comes next.
Absolutely. And I think you've got 2 great people to brainstorm what we can do more locally. And that's something we'll continue to chat about. One of the things I'll say for everybody's benefit is your local government can talk about anything. I often make the joke that you can write a resolution or proclamation about any given issue if it matters to your community. We were just joking about protecting our grandmothers, our memoirs in the world, because Preston was accused of not doing so in the last episode. You could do National Memaw Day if you wanted to. You could do whatever. And so My point is, you as a town, especially on healthcare disparities, on funding outcomes, all of these different things, should message at the community level. And if you're a constituent, ask your mayor, ask your city council person, experts like you, Laurie, communicate, right? What does it look like for us to beat the drum? And maybe it's celebrating, right? Maybe it's a resolution celebrating the fact that our senator has funded this and been an ambassador to it, and a resolution and appreciation for these healthcare outcomes that we're seeing.
Yes.
I think all of those things are great ways for us to lead. And then working with these local nonprofits, Blue Ridge Women in Ag, Hunger and Health Coalition, they have the same motto, food is medicine. We partner with all of these orgs. There's all these great local nonprofits that are doing the thing. And if you're a local government official and you're not talking to them regularly about what they're dealing with, you're messing up. So that's my appeal to all the local folks out there.
Yeah, there you go. Couldn't agree more. And then in addition to that, just to raise up a point that you made, Lori, it's just that neighbors helping neighbors, right? So many people have the power just in their collective voice. I can't tell you how many times that we've had a collective, really well organized group of people come to our town hall and want us to do something differently or advocate for something they deeply care about. And guess what? The court of public opinion is really strong. And a lot of times we do it because we care about our residents, we care about our neighbors, and we want to see outcomes better for everybody in our own community. So when you all come and talk to us about rural health transformation, healthy opportunities pilot, anything that matters to you and anything that makes our collective lives better, that's a good thing. And it makes things better for all of us. I've heard so many elected officials named on this call, on this episode, and so many organizations that I've personally worked with or interacted with. My dad donated his car to Working Wheels, right? Just to give you an example. And now
Amazing.
that car is on the road somewhere and it's helping somebody, hopefully, get them to their groceries or to their doctor's appointment or to school, right? And those things make us better as a community. Everybody here in our community, I think, has a duty and responsibility, if you have the capabilities, to really step up and show up for each other.
Well, thank you. Thank you so much, Laurie. This has been Do You Even Live Here? And then we're going to do a brief outro with just Preston and I believe, and just wrap up with a couple of things. Enjoy this conversation. Check out all the work that she's talked about. Support it. Write your senators. If they were on that list, thank them. Tell folks in the state legislature how important it is to fund programs like this, to support programs like this, and learn more about them. Because sometimes your elected officials don't know everything. So tell them, hey, did you know this was happening? And North Carolina is doing the right thing. Let's keep doing the right thing. Welcome back to Do You Even Live Here? I'm Dalton George, your host, with my other host, Preston Blakely. We're both young mayors, and we just talked to Dr. Laurie Stradley about some rural healthcare initiatives happening across the state, and really about the things that we need to know as North Carolinians to better advocate for healthy outcomes for our neighbors, especially here in rural Western North Carolina. We don't have a lot more to say other than the fact that she's an incredible guest. She clearly knows what she's talking about, and I know that this region and state are really lucky to have her. And when you hear something like these federal appointees are saying North Carolina is doing this right, that's something to hang your hat on and be proud of. I will say, us talking about healthcare stuff has had me very much focused on the fact that I'm going to the dentist tomorrow for the first time in years. I have been really bad about getting healthcare. I grew up actually without insurance for most of my life. My dad lost it when he lost his job, and so was not the type to get healthcare, go for checkups, and definitely never went to the dentist as much as I probably should have. I did go to the dentist after like 8 years, I will say, Preston. And I was like, they're going to pull all my teeth. It's game over, right? And
Yeah.
they're like, you only have one cavity. And I thought I was so up about
That ain't that bad.
That ain't that bad. I floated out. I was like, this is awesome. And then I did not go back for another 2 or 3 years. So I'm a little worried, but hoping we'll get some good news.
Listen, man, I got my fingers crossed for you. But yeah, Laurie was absolutely amazing. We're all very lucky to have her in West North Carolina. She's been a leader in the forefront of really advocating and implementing these big policies that have to relate to rural healthcare, and it's been a really big deal. And to your point about people growing up without insurance, sometimes even people with insurance, right? It's tough out there. I have a family member that's dealing with some health challenges now, when they've been going to a doctor a lot with insurance, and they're like, I'm running out of money, dude. And it's a tough thing to hear. And so there's a lot of challenges in our healthcare system, but it feels good to hear North Carolina's doing something right for once. And we're really excited about that for healthcare.
And to restate that appeal, tell your legislators that you're proud of this program. If you listen to this episode, you're proud of this, tell your legislators, communicate. One thing politicians like is getting some acknowledgement for the good things they're doing. We always make fun of them for that, but you would be surprised at how much it would mean to your House representative if they're good on this issue to hear from a constituent say, hey, I listened to this podcast, or I heard about this this program that you were quarterbacking, and then encourage it to be funded in the state budget if we ever get that adopted. And as we talk about budgets, I know that Preston and I have been in the throes of struggle season with our own budgets, some of which we talked about today, Boone even funding some adjacent programs. But I know that Fletcher just adopted their budget, so Preston is free for the next year. Congratulations, my friend.
More or less. Yeah. Yeah, we passed our budget this past Monday, which would have been Monday the 8th. We passed our budget unanimously. You guys heard me talk about in a past episode a 1.5 cent increase on our tax rate, property tax rate, and that was with support Fletcher Fire and Rescue. However, Henderson County ended up increasing their property tax rate, and we have this ad valorem system. And through that system, because they increased their property tax rate, we're getting less sales tax. And so because of that, to fill in some of that gap of those revenues that we're going to lose, we increased it a 0.5 cent over what we said we were going to do. And so we ended up doing a 2-cent increase, which it's not lost upon me how tight things are. But we also want to be able to continue to provide high quality services to the folk in Fletcher and make sure Fletcher Fire and Rescue and everybody else in the town is taken care of and services are delivered. And so it's always a tough go around, but we're proud to have it finished, and a lot of good collaboration between council, staff, and you all in the public help make this happen.
Yeah, and I think you're right as far as the county's impact on local costs and budget. And we have a similar, in my view, bad deal here in Watauga County and Boone, where we're losing about $4 million for the same tax system you outlined annually, which is tough. We had our final budget hearing. We've not adopted it yet, but the hearing went really well. I think people were mostly supportive. We're at a 4-cent increase, so 2 cents over yours. A lot of that is to be able to deliver on a number of projects that the can has kind of been kicked on. I will say to any Boone listener that's listening, we started at 5.5. I'm really proud of the council and myself and staff for navigating this and finding cuts that got us down to 4, recognizing exactly what Preston said. Things are tight, right? And we've got to try to find a way to be as good a stewards as possible. It's tough. This is my first budget session as mayor, I will say. You've navigated it for 4 years now, or I think this would be your 4th year as mayor navigating budget.
I think my 5th year, actually.
Oh, yeah, because you're a 5-year mayor. I forgot.
Yeah, 5-year mayor.
And so it's a different type of leadership, as you'd probably acknowledge,
That's
Preston.
right.
And my council was really supportive. They were great to work with, so we'll give them love. And Todd Carter, who was on the show, actually just commented on one of my posts and said, "Thanks for all your leadership." I was like, "Todd, you're the man." Forever a friend of the show, Todd Carter, and Preston Blakely relative somewhere along the way. Guys, that's really all we have for you. Stick around for next week. We've got some good stuff coming. Preston and I tomorrow will be hanging out in person, getting some content. I won't spoil what it's going to be, but I think folks will enjoy it. And Boonerang is coming up as well. You will see Preston and I at Boonerang.
Friend of the show, Gina Baxter, might be at Boonerang. It's going to be a collaboration of the minds of folk that have been on Do You Even Live Here?
There you go. And maybe Dorian Palmer might be coming
Maybe
up.
Dorian Palmer.
Thank y'all. This has been Do You Even Live Here? I'm Dalton George, young mayor of North Carolina in Boone. I'm with my co-host, Preston Blakely. We had a great conversation today with Dr. Laurie Stradley about some healthcare issues and real success here in the western part of our state. Thanks, folks.